My name is Christina Morris.
And what profession are you in or were in?
So I'm a nurse anesthetist. I'm still a nurse anesthetist, but I'm not practicing. I work full-time for the Frontline COVID-19 Critical Care Alliance. Now.
Right. Okay, so let's go back. Where do you want to start the story? During COVID, when you were bored?
Yeah.
Where do you want to start? You just go.
Okay, so my parents were both sick with COVID, and I was living abroad and working in the Netherlands and in the hospital as a nurse anesthetist, although they canceled our elective cases and moved us all to the ICU to take care of the sick COVID patients. So this was back in December, right when all the protocols were and the medications were being found out what works for COVID. And so I encouraged my parents to try ivermectin and the FLCCC protocols, and also America's Frontline doctors also had the same type of protocols. So I encouraged them to go get the medication and to start doing it, but they were scared to do it, to start the medication. So I flew over from the Netherlands to help take care of my parents, but it was a little bit too late because my father went to the hospital to get treatment in the COVID clinic and to get monoclonal antibodies. After having that treatment, he actually got worse, and they checked him into the COVID unit, and my mother was not allowed to go in. They luckily did not take away his phone, but his symptoms got worse. He went from being, he had difficulty breathing, but his oxygen was still stable. But after they gave him the infusion, then his oxygen got worse, and he had to actually be on oxygen in the hospital. He could barely speak, which was not like my father.
Had not taken the COVID shot?
No, my parents are not vaccinated. None of us are vaccinated. So, we wanted him to have the medication in the hospital, but they refused to give it to him. Now, this is my former employee, and I called all of my colleagues to ask to please give my father ivermectin, which he had the prescription for, in the hospital to go ahead and start treatment because he was getting worse. And they said, we don't use that medication in this hospital. And in fact, he'll get remdesivir in the morning. So I was a little bit stressed out about that situation because I knew that remdesivir was toxic. So my mother and I arranged for him to be removed from the hospital to check out with medical leave. And we got him home and we got him oxygen arranged in the house. And my cousin, who's a radiologist, was able to prescribe and get all the other medications that we needed. He already had the ivermectin, but he needed some other things like prednisone and other medications that required a prescription. And so we started treating him at home. And within 24 hours, he was better. He was able to breathe more normally, and after 48 hours, he was off of oxygen. And this was all after 2 doses of ivermectin. At the same time, my mother was also taking the medication, and she was also improving with her symptoms, but she wasn't as sick as my father.
So he did not get any remdesivir then?
No, I got him out in time.
Now this is the question, how did you get him out? Because 99.9% of the people that sit here cannot get their loved ones out.
Yeah, it was early in the pandemic, and we just checked him right out. And they were not blockading him leaving. I know that story has occurred often because I answered the clinical email lines for the FLCCC, and I've heard that story numerous times. But no, we were able to get him out. You just refuse medical treatment, you sign yourself out, and you can leave.
That's not been the case for many people.
I know.
So you're very, very fortunate. So you actually just proven you saved your dad's life from the stories we've heard.
Yeah.
He did not get remdesivir. You took him home, you gave him ivermectin and some kind of protocol, and he was up and about.
Yeah. Just like the studies show that ivermectin works within 24 hours, he was improved in 24 hours, and he was off of oxygen in 48 hours. And he was in the inflammation stage of the virus, like when people really take a turn for the worse. So we knew it was vitally critical that he get the ivermectin at that point.
So let's talk a little bit about what does work. And this is not giving out medical advice. Everyone watching Children's Health Defence does not do that, and nor does my guest here give out medical advice in this situation. But let's talk about what you've seen, the injuries, and how you've seen people improve.
Well, I can tell you that ivermectin and hydroxychloroquine work. They work well for patients. And also taking vitamin C, zinc, probiotics, all of those things, all those elements in those treatment protocols with my organization. Doing nasal spray, like the povidone iodine, when you first get sick, when you first have symptoms, if you start spraying povidone iodine in your nose 3 times a day, That reduces the viral load. So does gargling with mouthwash. So those are simple things that people can do at home. But taking quercetin, vitamin C, vitamin D, making sure your vitamin D levels are up to par, so just not too low. A lot of people walk around with low vitamin D levels and don't know it. If you make sure all those things are available and at home before you get sick, then you can avoid the situation of going to the hospital. So it's actually a good plan to make contact with a provider that can prescribe what you need, because most of this is over the counter, to have in your house, so when you do get sick that you can immediately start treatment with the treatment plan that was prescribed to you from the provider.
Now, does the frontline doctors only deal with COVID and COVID? Do they deal with other injuries?
Yes.
Because we have so many people that sit here, and like we had those beautiful twins not long ago. I mean, could they go to frontline doctors for help?
Yes. Yes. They treat long COVID. They treat long vax or post-vaccine injury. They treat cancer. They treat everything.
So if they hypothetically wrote a prescription up for me for ivermectin, the next problem we're hearing is that no one will fulfill those prescriptions. So how do we get over that?
So I would avoid going to the major chains like CVS and Walgreens and all those places. If you go with a provider on our provider list, they usually work with compounding pharmacies, and the pharmacies have a relationship with the providers, and they can get the ivermectin sent to your house with a prescription, or you can order ahead of time from our pharmacy list.
How bad are these injuries you're saying or hearing about?
What, like the post-vaccine injuries, the long COVID, everything is really bad, and it's getting worse because a lot of people don't know about treatment because everything is censored. So the news doesn't want to tell the stories about what's going on, and mandates are still happening, whether they're legal or coercion and social pressure, or maybe private organization policies. People are continuing to get immunizations and they're getting sicker. So if you don't treat the inflammation from like whatever's causing your inflammation, you get a shot or you get long COVID and it's left untreated, you can get sick with chronic illness, a lot of different chronic illnesses.
Here's the question that many people, I don't know what to call these people who are not quite within our movement yet, will say, if your protocol, if these things work so well, why are they banning them? Why are they saying ivermectin's dangerous? Why are they doing it? What is the reason? They can't get their heads around, if it was good, it would be available for us. What is your answer to that?
Well,
you just say it the way it is.
We all know within the movement what the issue is. The issue is the pharmaceutical industry controls everything. They control the government, they control the military, they control all these schools, all the research journals. So they basically produce research that paints ivermectin and all these other repurposed drugs in a bad light. So they manipulate the studies to give the outcomes the way they want them. So if you don't know how to read research, even healthcare providers are a lot of them don't understand this. If you don't read them carefully, then you don't pick out how they've manipulated the study. So the reason why they're basically keeping this censored is because of the emergency authorization for the vaccines. If they had something that treated COVID and these illnesses, they wouldn't have had the ability to push the vaccines through. And then the pharmaceutical companies have these new drugs they're pushing out, plus monoclonal antibodies. Everything is controlled by money. So they don't want cheap repurposed drugs to be known by the general public to be used to treat these illnesses. And it sounds very diabolical, but I almost feel like that they want us to be sick so that we continue to need these medications and that we don't treat inflammation and underlying issues that are not in balance, which is causing chronic illness. And when I say chronic illness, I'm not even just speaking about long COVID and long vax. I'm talking about Lyme, mold illnesses, other inflammation issues, neurological problems. I mean, a whole bunch of different things. So it's kind of a very dark situation that we're in. Yes.
Yeah. Okay, so tell people where to go, but I don't normally do this, but I think it's critical as we're going into, everything's getting really cold now.
Yeah.
People are starting to get sick. You can hear it everywhere around. There is help out there, people.
Yeah, there is definitely help. My organization, the FLCCC, has
Which stands for
Frontline COVID-19 Critical Care Alliance.
Pierre Corey
and Paul Merrick.
You all know them. They go on CHGTV the whole time.
Yeah,
and good doctors.
Yeah, and so we have a provider list with telehealth providers. Some of them have brick and mortar practices, some don't, but you can be seen by a telehealth provider to get what you need to be seen and to treat any illness that you have. And we also have a pharmacy list. So if you plan ahead, you can order medication from India, Southeast Asia, other companies that offer the medication without a prescription, or if you have a prescription, you can also go to these pharmacies and get your medication shipped to you. So those are options that we have to help people find the resources that they
you
need.
Must be careful, everybody. You can't just buy ivermectin off the street.
No, I wouldn't do that. I mean, the better way to do this is to go to a provider and get a prescription, and the best is to get a compounded ivermectin prescription for you because it's based on your weight. So it only comes in one capsule. You don't have to take multiple pills because the dosage of ivermectin normally comes in 3 milligram, 6 milligram, 12 milligrams. So a lot of times you have to take multiple pills to get the dosage that you need, and that's confusing for some patients.
Okay, so once again, no one's giving medical advice out here. It's just this lady's opinion and the job that she does. Okay, so let's get that absolutely clear. I want to go back to the Netherlands now. So you were there during the COVID era. What was it like in the Netherlands? Was it strict like England and all those other places, or was it a bit more like Texas, a bit laid back?
No. So I lived in the Netherlands for 10 years, and the last 3 years I lived there the 2 of them were during the pandemic, and it was pretty bad. We were locked down almost consistently for 2 years. We weren't allowed to go to the movies or restaurants or any sort of public place without a vaccine card. Once the vaccines were released, they were basically trying to through social pressure, try to get everyone vaccinated. They were trying to get teenagers vaccinated by giving away free pizza. They were doing all sorts of tricks to get people to take the shots. I didn't have to take it. I just told them I wasn't, my hospital, I said I wasn't doing it, and I showed research why I didn't need it, and that I had the virus and I had natural immunity, and until they could prove to me that I needed it, I was not having the shot. So I managed to avoid that situation. But it was terrible. I fled the Netherlands and came back to the States because I was tired of being locked down. They were going to lock us down again for Omicron. The government, the leader of the health bureau had no medical degree. He was in fact a school teacher, and his brother works for AstraZeneca. So they had bought the shots ahead of time. So they had to push the shots on the citizens of the Netherlands because they had spent the money on the shots to get it done. And we had the COVID test. Everyone had to be tested and isolated and everything. Now, we had an unelected body that was basically regulating our COVID regulations, and those people had investment in the COVID tests and also in the pharmaceutical industry. And these people were mandating what all the individuals in the Netherlands were doing. And just like here, non-essential businesses were closed, so a lot of small business owners went out of business. I was able to work because I was in the hospital, but in the hospital, all the elective cases were canceled, so only emergencies were allowed to happen in the operating room. We were closed and sent to the intensive care unit, where they followed protocols to treat the patients, which were not scientifically based on the best outcome. And when I came back from the States to the Netherlands to go back to work, and I showed them the protocols that I had used, they basically shut me down and said that it didn't come from Erasmus Hospital, so they weren't going to use it. And so
were the same things happening over there as are happening, the stories we're hearing of hospital protocol deaths? Were you seeing that over there as well?
Yes, absolutely.
So this is potentially a worldwide
it was
issue.
Definitely a worldwide issue. It happened everywhere.
The culling of millions.
Yes, absolutely. Absolutely. So it was the patients weren't allowed to be with their family members. They were only able to visit through video, FaceTime or whatever was available. They weren't able to get ivermectin. Oh, here's another interesting thing about the Netherlands is the doctors who were actually awake and trying to help people and were prescribing ivermectin, hydroxychloroquine, they were fined if they were prescribing the medication. So they became afraid to do so. It was like a $20,000 fine, or it may have been a little less than that. It was an extreme amount of money for a normal individual. But if they were found to, the pharmacies would report them, so if they were found to have prescribed it, they would have to pay this fine. So the only way to get ivermectin in the Netherlands was to import it in from India or China. But then at that point, customs was seizing packages and destroying the medications coming into the country. So it was a pretty hefty situation. We actually had it a little bit better over here in the States because at least patients could get medication prescribed to them and could actually get help. They didn't have that luxury in the Netherlands and in most of Europe.
And you fled the Netherlands to come to America?
I did.
It's extraordinary.
Yeah.
Did you travel anywhere else?
I did. I went to Sweden during the pandemic, which was a lot more relaxed than the Netherlands. I went to Germany and Belgium. I've been to Spain.
During the whole COVID thing?
Yeah.
So describe the different countries and what was going on there, or was it just the same everywhere?
Well, they all had, every European country has their own regulations. So they basically based it on the current infection rate, like what rules they were going to follow. So whether they were allowing people in or locking down, whether you had to have COVID screening or, eventually COVID shots to enter the countries. When we went to Sweden, that was kind of in between lockdowns. We drove straight through Germany because if we would have stopped, we would have had to have a COVID test. So we drove straight from the Netherlands to Malmo to have a vacation. And once we were in Malmo, everything was very relaxed. They weren't, blockading people from going out and eating or going to museums or doing the normal things of everyday life. And I think we all know that Sweden had a better COVID policy than most of Europe. And the major extreme was Austria was pretty bad. They were checking COVID passes when people were going to the store, and if you didn't have your papers, then you got a fine.
Papers meaning vaccination papers?
Yeah.
So you couldn't really go out unless you had your papers?
In Austria, yeah.
God, that must have been post-traumatic stress for them.
I mean, I think the whole entire world is having PTSD from the situation. And then not to mention the kids and teenagers were not allowed to go to school during the lockdowns, just like here, but those kids lost major time in their development, their social development, and children who have had to wear masks on their faces, like they're behind on learning, like it's been proven in studies. So it was a bad time, the pandemic, all over the place. It wasn't just in the States. So, yeah.
What else do you want to talk to us about? What else have you discovered that you want our people to know about?
Well, I think we're kind of on the beginning of the severity of the whatever you want to call it, long post-vaccine syndrome, people who've had the shots and now they're having side effects. We are just now, even after 2 years, seeing an increase in patients needing help. And it's concerning because no one's covering it besides people in our medical movement bubble. So the news is basically, these sudden deaths that are happening all the time. They're saying it's, heat stroke or I don't know, whatever they are making up. There's so many stories that they say it is, that to cover up the fact they've had a heart attack or a stroke or myocarditis, which ended up in sudden death. And it's young people. I'm very concerned about the military. That's my personal passion, is to help them, because we have young people in our military who have their careers ruined. Pilots also, they are having heart attacks while flying. Students, like 20, 30-year-old men and women, are having issues with their health, and they are the healthiest of the healthy, the pilots in the military. And they can't fly anymore because they're grounded, and they can't get a job after that because their careers are ruined because they've had this medical issue, and the military is ignoring it. They're not allowing screening and treatment with people in the military, and on top of that, the people who left because of the mandates, and gosh, they had every right to. They shouldn't be forced to take anything that they don't need. They've left, and now they're calling them back, which is interesting. But so we have people who have left. We have people who are sick and are not able to work anymore. We have a low recruitment number, a low retention number. We're in a lot of trouble.
And it's what they call flu season, and the military have just all had their flu jabs.
Yeah.
Flu miss, whatever it is.
And
so
they are forcing that too, and they are giving them a hard time with exemptions. Like the only thing that is working right now is religious exemptions, but it's very tricky to get those because it has to be from an internal military provider giving those exemptions. So we're trying whatever we can do to help these people get what they need. But even people who are out processing, who are leaving, are having to get shots. Like I know someone who had a tetanus shot the other day, a booster, and they had the Johnson & Johnson shot 2 years ago, and their brain fog has gotten worse. Their arm is really sore. Like the person who gave them the shot thought they needed an anthrax booster, and this person was concerned they maybe even got the wrong shot because this person was so distracted while they were pulling out the medication out of the refrigerator, and the refrigerators were right next to each other. They were really worried they got the wrong shot. But why are they mandating these shots with them leaving? And they should have informed consent anyway before they get injected with anything. That's their right.
The other thing that's very concerning is the people reporting that depression, anxiety, dark
Yeah.
things on in the military because they're so jabbed.
Yeah.
We did a story about someone having exactly this issue after Johnson & Johnson, and a viewer, thank you for that, sent me in that actually if you look at the VAERS, it's not just Johnson & Johnson, it's all of them
yeah.
that are causing these suicidal thoughts,
Yeah.
depression, and we don't want our military to be in
No.
that situation. We should be making them fit and healthy, not destroying them. We're destroying them.
Yeah, I know. And is that also a dark thing that someone wanted to maybe make us vulnerable for a future attack? I don't know. I don't want to play these scenarios out, but
well, it's the elephant in the room that no one's talking about.
Yeah.
But if you were the dark side, what would you do?
You would take
Cripple
out
the defense
from within
right.
in a way that no one's noticing and no one's addressing. But I also want to bring to the point of depression and all these mental issues that are post-vaccine related. They are inflammatory processes with the spike protein. There are ways to treat this. There are over-the-counter supplements that you can take. Intermittent fasting is the number one thing that people can do to reduce spike protein in their body. Taking things like Nigella sativa oil, and again, this is not medical advice, but these are just things people can do. Taking magnesium threonate, which helps the brain. Green tea, coffee. We just updated our treatment protocols to include these things in our prevention and our treatment. Yes,
Cup of organic coffee.
Yeah, it could be organic. It doesn't have to be. It can be decaffeinated. It can be caffeinated, but it helps reduce the spike protein attaching to the ACE receptor. So it's very interesting. And a lot of these prevention elements in our treatment guidelines that we use for post-vaccine inflammation are also anti-cancer. So that's kind of a double bonus, taking things like berberine and green tea.
All right, tell everyone again the site to go and make their own minds up of whether they want to follow along.
So everyone can go to flccc.net, and if they have any questions, they can email clinical@flccc.net, and they'll get myself or my colleague Samantha.
And anything else you want to tell the people?
That there's hope, that don't lose hope and don't let despair take you over. Just changing your lifestyle and making healthy choices and taking a few supplements, cleaning up your diet and seeking help, you can really change the way the inflammation is in your body and get healthier. So don't lose hope.
Fantastic. Thank you so